ncIMPACT is made possible by funding from Civic Federal Credit Union. ncIMPACT is a production of UNC-TV Public Media North Carolina in association with the University of North Carolina School of Government.
And then you see people standing side of the road trying to catch rides, and your heart just go out to them.
They have no way to get from point A to point B.
Transportation rises to the top in rural areas very clearly.
This is a community-built program using community resources, community dollars to transport people from our community.
I've been using the program for about a year, and it's been really a lifesaver for me. It's been great.
Education, jobs, health, all these issues affect you. Leaders from across the state, people just like you, are working to make things better. The question is, could you do this in your community as well? I'm Anita Brown-Graham. This is ncIMPACT. For many who live in rural communities, access to reliable public transportation can be an issue. The lack of transportation options can lead to missed doctor visits and the difficulty in accessing other basic necessities. In Hertford and Bertie counties, the communities have come together to offer on-demand transportation services to their residents. Let's look at the impact of this solution.
You don't have a ride for tomorrow?
This is Shonoke Public Transportation Authority, and we are a transportation provider for a 4-county area, which is Bertie, Hertford, Halifax, and Northampton counties. It's basically on demand. We do not have any fixed routes in a rural area, so it's the demand of the transportation. We have routes that are formed in every county. Some counties have more than one route.
What the dirt does when it gets empty.
We're not a one-on-one provider. You know, we operate vehicles that are from 10 passengers up to 20 passengers. The senior population, you know, sometimes get to a point where they are not able to drive. So we are here, you know, to help those out that, you know, if they need to go to a medical appointment or if they need to go. A lot of them go to senior nutrition centers throughout the county, so we take them there as well. And shopping. Some nutrition centers, you know, give shopping trips to pick up some groceries and things of that nature, so, you know, we provide that as well.
From, you know, going to doctor's appointments, to the gym, to dialysis, and, you know, like with dialysis treatments, you have to have that or else it can, you know, cause your health to fail quickly. So being able to provide that to patients that need that is very valuable.
One, I would say for us, is our dialysis patients. You know, that is a vital need to get back and forth to the dialysis center. Usually a patient goes at least 3 times a week. So that is, you know, that's a vital need.
Welcome all. Jason, let's start with you. Give us some sense of the challenges some rural residents are facing in terms of transportation.
So the challenges rural residents face with transportation, and specifically those to health, is really a perfect storm of a challenge. First, you have rural North Carolina, which is generally less healthy than urban or suburban North Carolina. If you look at the Robert Wood Johnson Foundation county health rankings, the least healthy 25 counties in the state are all intensely rural, factored into the northeastern part of the state and in the Sand Hills south side part of the state. So you have that challenge. Second, you have a challenge of rural North Carolina that is aging. North Carolina generally is aging, but rural North Carolina is ahead of the curve.
Right.
So you have aging individuals with chronic needs. 3, you have the challenge of providing public transportation in rural areas. Public transportation works best when you have density. That is not rural North Carolina. It's estimated, based on what I've heard from the rural planning organizations we partner with, is that approximately 6.97% of the rural population in the state does not have an automobile. My guess is that skews to an older population. So the challenge is that a high population with high health needs, limited access to public transportation.
So Hannah, you're with the Department of Transportation. These are not surprising statistics for you.
Absolutely.
How is your agency responding?
North Carolina DOT partners with transit providers all across the state. We've got 98 systems that are covering every community in North Carolina. But as we go through this Medicaid transformation, we are really faced with some daunting challenges about how we continue to provide that level of access to communities and every person across the state. So we are paying attention to those things and looking for opportunities to innovate around new technologies, new collaborations, and finding ways to partner together to be both efficient and reach every community.
So lots is being done, Brandy, but what are you hearing on the ground about the gaps that still exist?
Yeah, so we're definitely aware of the wonderful programs that currently exist and the innovation that communities are creating because they generally have to, right? What we're also hearing is there continue to be gaps or people getting access to transportation to get to work, right? We know that in more communities that anchor institutions are really centered in a rural community. And so for folks on the outskirts really having the need to gain access to those services have to go from out to within to where those those services are really located. So to that effect, what we hear from community members is that the challenge still remains, that while we do have great programs, there is still a significant need.
We've got a few moments left, Jason, and I want to get back to this issue of the perfect storm. Are we coming out of it?
No. Our public transit systems in rural North Carolina are funded on a shoestring. So we've got a lot of challenges ahead of us. And we've got some decisions that will be made in the short term, both in terms of the management of the system and what the state's policy is going to be around Medicaid expansion or closing the insurance gap.
A new pilot program in Hertford and Bertie counties is helping people provide transportation for rural residents to get to the hospital and their medical appointments. Let's look at the impact of the TRIP program and how it's already improved health outcomes and reduced hospital costs.
You know, years ago I had a car accident and I couldn't turn my head. I had to go to a chiropractor, and then I developed a paraesophageal hernia, and I found out that was from the accident where it cracked my diaphragm. And I'm healed from that, but then I had a series of cars that were really a problem. It's very expensive. The last car I had, somebody come and tow it away.
A lot of patients and a lot of people in the community, they have to pay for rides. They have to pay their neighbor, their friend, and it can get expensive. HHMA TRIP, like we call it, for Hertford Health Maintenance Alliance. It was a program that was developed by community stakeholders, hospital, community health center, and we saw a need in our community centered around a barrier of transportation. You know, we know this is an issue that not only impacts our community, but communities across North Carolina, across the nation. And we wanted to have a solution to this problem, but we wanted to make sure that our solution was tailored to the patient. So we worked with the local companies around the area, and we put them into our system so that we can transport our patients using our own community resources. We got our grant funding from Ronald Chawan Foundation. Our patients get transported for free of charge. The patient don't pay anything. We've been in this pilot program for a year and a half, going on 2 years, and we've seen some remarkable things happen for our patients, and we are very proud to make a difference in their lives.
I've been using the program for about a year, and it's been really a lifesaver for me. It's been great. I've been working out, and I lost 10 pounds. It takes out the worry of trying to get somewhere where you don't have any transportation, and it's just been really helpful to me.
Hannah, let's talk about a program like Project TRIP in Hertford County. How is that changing the game?
Programs like TRIP are a great example of how communities are really focusing on being innovative and trying new things as they are working to address these transportation gaps in rural communities. North Carolina is really interested in really leaning into innovation and finding new ways to leverage technology, community relationships, exactly like they're doing in Hertford.
Brandy, who are the stakeholders in a program like TRIP?
Yeah, so definitely anchor institutions, so your hospitals, your federally qualified health centers, your school systems, the institutional organizations and communities that are centered, right? So the centrally located organizations and community. Also partner organizations, so community-based organizations, churches are involved, civic groups are involved, and making sure that a program or project like TRIP is really successful.
Jason, how do you see the promise of programs like TRIP as they replicate or scale across North Carolina?
The promise of them is that they are looking at the assets of the community. Rural solutions have to be based on the assets in rural places. What makes rural places distinctive is that they're highly personal, they're relationship driven, it's a high touch environment. So we have to look at replicating by building on what are the trusted institutions. For example, and I thought it was great that we're focusing on Hertford County through work the Rural Center is doing with the Duke Endowment. We work with 2 Methodist churches in Hertford County to help them think more creatively about how they have impact in their communities and come up on solutions. And I would love to see some examples of how do rural churches who have buses and vans that remain parked and empty during the week that can be used as a solution for transit purposes.
So let me pick up on that with you again, Hannah. What role then does a state agency have in supporting these kinds of local innovations?
So North Carolina DOT plays a couple of different roles, particularly with community public transportation systems. We are a convener. We also provide a large chunk of federal funds as a pass-through to these organizations. And then we are also FTA's eyes and ears on the ground, ensuring compliance with the numerous federal rules.
And what is FTA?
For the Federal Transit Authority.
Thank you. Brandy, does this excite you?
Very much so. I think there are innovations being created across rural communities across the state. We're excited to be able to support those organizations and networks coming together in really thoughtful and intentional ways.
Jason, what's next?
Well, I think we've got to keep testing innovation and then get to a stage where there's the peer learning across rural communities so we can get to scale. The challenge is that we can always push for innovation. It's the getting to scale that's the challenge. And in this case, it's how do we create innovative solutions that build on the public transit programs that are there, that are underfunded, they're overwhelmed, they're so that we're not undercutting the infrastructure that's there.
Many rural residents who struggle to find reliable transportation also face employment barriers. Let's look at the impact of how one organization contracts with transportation companies to provide affordable rides for those trying to get to work.
There's people that cannot get to work. We've had calls of people that had gotten hired, but because of lack of transportation, they would not accept the job.
And then you see people standing side of the road trying to catch rides, and your heart just go out to them.
Transportation rises to the top in rural areas very clearly. So we began to think, what if we did our own kind of local Uber? We have local transports, local taxis, Mom and Pop Taxi, and a couple of other organizations. What if we were to design a program that it was Uber style and work through our case management here so that it was someone coordinating that and utilize transportation for our highest need patients.
The name of our business is Hinton's Employment Transportation Service. It's very important to our riders that they know they can depend on us. And we make it a practice to be reliable. The cost of it It's not expensive. It's not a large sum of money. By way of grant is the way that we are being paid for it.
The key seems to be able to be on demand, have it not be just limited to coming to the medical visit, and how it can support that patient's lifestyle. It's really about not just those who walk in through our doors, but the impact on the community, financially, emotionally, spiritually, equity-wise, and how do we reflect that we're right here? You are who we are.
It would be wonderful if this transportation piece would expand and that others will model after it, because it will help so many people. It will help so many people.
Brandy, many communities are still facing huge gaps in terms of public transportation, especially transportation that gets people to health care. How do you get started on a local innovation?
Yeah, so most definitely what we're hearing in community is that there's a shortage of workers. So for individuals who need jobs, like for example, and so when it comes to the transportation services that currently exist, they're in need of drivers for their programs, right? And so finding a qualified workforce to be able to put in those positions. And, you know, communities are partnering, they call it supplemental transportation, so not to undercut the existing programming, but to supplement what's already there. So those folks are also in need of drivers. So people are creating these transportation services and programs, but the workers are needed to be able to reach the most needy.
What are the other challenges a community might face, Hannah, as they try to develop one of these local supplemental transportation programs?
I think one of the challenges that Brandy brought up is really spot on, the ability to really provide those wraparound services and coordinate between those more formal services and the informal services that are allowing these innovations to occur.
So say more about that. What is that connection between the formal and the informal?
I think there are a number of ways that that can happen, and it can really be customized to the community. It can happen through some informal channels like relationships with area agencies on aging, the community's county DHHS systems, as well as the public transportation providers themselves. It really is hyper-local in how those relationships are already in existence and who's got those connections that they can leverage.
So you need a workforce, you need relationships, connections. What else would you need in a local community, Jason?
Well, I think there has to be consensus and a sense of vision on how this particular transportation issue fits within the broader context of the transportation challenges any rural community has. It's a challenge of attention, that is having local leaders who understand where transportation is going in the future and can articulate their needs to their RPOs to develop plans and to work with DOT around funding projects. It's an issue of money. Most of the state transportation money, and for that matter federal money I would guess, but particularly the state money, we have hyper growth in our urban areas. Much of our transportation dollars, rightfully so, goes there to deal with congestion issues. So rural communities are always having to make tough decisions of, well, do we focus on our limited resources we have access to on repairing that bridge? Is it widening a road to make it safer for general transit? So this issue is embedded within a very difficult challenge and larger issue of rural transportation.
We all share many of the same challenges in our communities, so why not share the solutions as well? Each and every one of us can make a difference. That's what having an impact is all about.
ncIMPACT is made possible by funding from Civic Federal Credit Union. ncIMPACT is a production of UNC-TV Public Media North Carolina in association with the University of North Carolina School of Government.